Ladies and gentlemen, welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. I've been in practice for more than 40 years. The feature presentation is fish and fish oil, pros and cons. What is so interesting about fish? What is so interesting about fish, which is recommended by most medical professionals and especially heart doctors? What is in the fish? And what type of fish do you really need to look at? And we also look at what are the different types of supplements that can help to get the same results if you don't like to eat fish. And let's unravel this mystery. Let's begin with the presentation. As you know, fish is supposed to be rich in omega-3 fatty acids. These are polyunsaturated or monounsaturated fatty acids, which are the essential building blocks of cellular tissue, and they are essentially needed in every part of your body, starting with your brain, lungs, heart, kidneys, your arteries, your extremities. Everything involves the utilization of omega-3 fatty acids, and especially your liver too. So let us see what we can learn from this presentation. Basically, the fish oil contains two kinds of fatty acids, omega-3 fatty acids. The first one is known as the EPA, which is more important as far as the heart and vascular system is concerned, and it is explained as eicosapentaenoic acid or docosahexaenoic acid. So these are basically fatty acids, short chain fatty acids. They are omega-3 fatty acids. And majority of the good source of EPA and the DHA comes from salmon, mackerel, oysters, crabs, trouts. We'll look into that a little later on. As I said, not all fish are going to provide you the kind of omega-3 fatty acids you need, especially EPA, which works on the heart and vascular system, and DHA, which can penetrate into the brain tissue and help with some brain function. Okay, how does the omega-3 fatty acids help to reduce the cardiovascular risks? That's a very good question, and the important aspect is it improves cholesterol levels. It increases the HDL cholesterol level, which is the good cholesterol. It lowers the LDL or the bad cholesterol. It also decreases triglycerides, and one of the major benefits of omega-3 fatty acids is to dramatically reduce the triglyceride levels by 15 to 30% in some studies. As you know, triglycerides are an independent risk factor for heart disease. The higher your LDL level, the higher is the incidence of heart disease. The higher your HDL, the good cholesterol, the lower is the incidence of heart disease. Even triglycerides have been found to be independent risk factor for heart disease. So let's keep in mind, by using these omega-3 fatty acids, we can obtain a very favorable lipid profile that is heart healthy. Mayo Clinic describes the benefits of the omega-3 fatty acids, especially the ones which are coming from the wild fish. It improves the heart disease. It also lowers the blood pressure by improving the resistance in the blood vessels. And I already talked about triglyceride levels and cholesterol levels. And it has also been found to be useful in rheumatoid arthritis. Most of these diseases, like heart disease, diabetes, hypertension, arthritis, all this inflammation, are chronic diseases which are to a certain degree thought to be related to inflammation. The other benefit of omega-3 fatty acids is they are anti-inflammatory. That means they reduce the inflammation. That is, they reduce the irritation around the tissues, which helps to reduce the symptoms of patients with rheumatoid arthritis. So anti-inflammatory properties are an important part of omega-3 fatty acids, especially coming from a select group of fish, which I talked about, and we're going to emphasize it again. In addition to these definitely established improvements in cardiovascular function and may even reduce blood pressure, it also helps in lowering the inflammation. It has also been found to be helpful in mental patients with certain mental illnesses like schizophrenia or depression, because in these conditions they have been found to have lower levels of the omega-3 fatty acids. Omega-3 fatty acids are very essential in maintaining cellular function, and especially in the brain. When you're talking about cellular function, you're talking about the sending and receiving of nerve impulses. That's improving the level of omega-3 fatty acids in the brain may help to reduce some of the symptoms related to these chronic illnesses like schizophrenia or Alzheimer's or even depression. The literature says that 70% of the brain is made up of fatty tissue, which is basically omega-3 fatty acids. That means brain needs a lot of omega-3 fatty acids, and if there are low levels of omega-3 fatty acids, it can lead to certain symptoms. It has also been found to be useful in eyes in terms of age-related macular degeneration, or AMD. By taking omega-3 fatty acids, it's been shown to be delayed, but there's no conclusive evidence on some of these claims. And skin is very dependent on fatty acids. If your skin doesn't have fatty acids, your skin is going to get dry, it's going to get crackles, and it's going to get bleeding, it's going to have itching, all kinds of stuff. So replenishing omega-3 fatty acids is very important to maintain healthy skin. And it also gives the natural texture of the skin, because if you are low in omega-3 fatty acids, your skin can be dry, wrinkled, and scaly. As we get older, as you know, the body doesn't have enough fatty acids in the skin, and hence supplementing this through the diet or with supplements may benefit those patients. Similarly, it has also been found useful in pregnancy. It is directly related to the amount of increased omega-3 fatty acid demand during pregnancy for the developing baby inside the womb, and thus supplying extra amounts of omega-3 fatty acids may help with the baby's nourishment. Liver is a place where all the metabolic components like carbohydrates, proteins, fats, they all come, and they are all kind of churned into what exactly body needs. And anything the body doesn't need, for example, if you got too much carbohydrate load, it's going to be sent to the fatty tissue to be deposited as fat. So in other words, your extra carbohydrates are going to be converted into fat, and that's going to be deposited permanently in all those bulgy places in your body. However, liver also manufactures all the enzymes, hormones, many enzymes and hormones, and they all need omega-3 fatty acids. And those people who take omega-3 fatty acids on a regular basis have been shown to have reduced symptoms related to non-alcoholic fatty liver disease. So as you know, as people drink and as people get older, there is fat deposition in the liver, and that can interfere with liver function. But by supplementing omega-3 fatty acids, it may improve the liver function also. And I talked about depression. So it may also help with hyperactive children, but I don't treat children, so I don't have very much experience as far as fish and omega-3 fatty acids helping children with attention deficit disorder. So I will just kind of leave it at that time. It has been found to be useful in patients with asthma and allergic risks. Again, it all goes back to inflammation. And in one study, they found that it reduced the risk of asthma by 24 to 29%. But these are all studies which are looking at retrospectively. But nonetheless, omega-3 fatty acids are very useful from many angles, and hence there's no harm in using omega-3 fatty acids or its sources. Bone health. Usually the bone health is dependent on calcium, it's dependent on vitamin D, but nonetheless people with osteoporosis, older people, they are found to have reduced levels of omega-3 fatty acid in the body, and hence taking omega-3 fatty acids may improve bone density in these patients. Okay, what are the real sources of omega-3 fatty acids? There are like thousands of fish available in this, maybe millions of fish available in the sea or in a local pond, but they all don't provide you the kind of omega-3 fatty acids which I was talking about, namely EPA and DHA. So those are the kinds which you need to be focusing upon, and these are the kind of fish that have a high concentration of EPA and DHA, namely salmon, sardine, Atlantic mackerel, cod, herring, trout, and like tuna. Please remember that like farm raised or tank water raised catfish and other things don't carry the same level of omega-3 fatty acids as you see in the wild Alaskan salmon or mackerel. That's an important point. So when you go for shopping, you need to look for wild salmon. Don't get a farm raised salmon because you may not get the quality and the quantity of omega-3 fatty acids that you expect, and you may end up paying the same amount of money. Okay, how much omega-3 fatty acids do we need, and how are we going to get it? And especially if you are one of those who doesn't want to eat fish, what do you say alternative? Okay, we're going to talk about that. The World Health Organization recommends 1.1 to 1.6 grams of omega-3 fatty acids per day. However, the dosages may have to be increased in like pregnant women for obvious reason I talked about, or nursing mothers, and also to reduce cardiovascular risk in patients with heart disease. Many supplements contain like 1,000 milligrams of fish oil. Don't be misled by the labels because the labels are very deceiving. I mean, I'm talking about the front labels. Always look at the back of the bottle or the can where they have the nutritional tables. That's where the real story is. And they may contain like only 300 milligrams of combined EPA and DHA. So you're not getting 1,000 milligrams of EPA or DHA, you're only getting 300 milligrams. However, the standard recommendations are 500 milligrams of EPA minimum and 1,000 milligrams of DHA. That means you have to take, maybe 3-4 capsules a day. But when you take some of these fish oil capsules, you need to be concerned about the side effects, which I'm going to mention in a minute. Those side effects are very, very important to keep in mind. And there is a prescription drug, which is known as EPA, which is sold under the name Vascepa, which is available. And you have to take 4 grams, that is 4,000 milligrams per day to lower your cardiovascular risk. And look at the cost here, ranging anywhere. This is from GoodRx, the discount prescription place, $111.50 all the way up to $325. So unless you have a prescription plan, it will be hard for anyone to sort of afford this kind of a price just for one cholesterol lowering medication, in addition to all the other ones you're taking like Lipitor or rosuvastatin, or you're taking like Tricor, any one of those extra ones. This is a supplement to that. But nonetheless, the study which looked at this Vascepa or EPA showed there was almost 20 to 25% reduction in cardiovascular risk and mortality in patients who were taking this Vascepa. So this is a medication that is generally recommended for people with very high degree of cardiovascular risk, with multiple stents and bypass surgery, along with diabetes, hypertension, and high cholesterol levels. That's where you use this one. But generally speaking, most people should be able to get that through natural sources or with supplements. Talking about supplements, let's focus on some of the harmful effects of these supplements. Omega-3 fatty acids are known to increase the bleeding tendency. So if you're already on a blood thinner, like Plavix or aspirin or warfarin, then it can increase your risk of bleeding when you're taking too much of this fish oil or fish as a part of your diet source. It can also cause heartburn, loose stools, and of course, some of us don't like the fish smell. I want to caution you about sometimes you get mercury poison from some of these fish that are sold in the market. There's no way you can know because they don't tell you how much mercury is there, but it has been shown that this mercury poison over a period of several years, like 5 years or 10 years, can result in all kinds of skin rashes. So if you're having unexplained skin rashes, it happened to me. That's why I'm telling you from a personal experience, because I was taking fish oil for like more than 10 years. Then my skin in the arms and legs was getting so dry and cracked, and I saw 3 dermatologists and they said, oh, you're just getting old, you're going to have a dry skin and this is going to be your life. Then I looked through everything that I was going through and I dropped this fish oil capsules because I said, I don't want this. And it took like years to get over. Now my skin is back to normal. So be aware that mercurial poison can be a concern with some of these fish sources. And I talked about they can interact with blood thinners. They can also it also reduces the blood pressure, and it can interfere with the contraception drugs, and it reduces vitamin E level. So ladies and gentlemen, this is a very quick synopsis of omega-3 fatty acids, fish oil capsules, their pros and cons. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and we'll see you in the next video. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. See you.